Hello, everybody. I hope that your day is going well. I randomly just decided to jump on here. I was going to record a video, but I was like, let me just go on live on Facebook and YouTube and just see how many people are even on. Um, Next time, I think I'll try and plan my lives. I really want to start going live. More often from time to time. But today I had a couple of things in my mind that I wanted to share with you and that I know that can help you. And of course, I often use my own experiences as lessons and teaching points. And so this live is for the ladies, particularly if you are in your late 30s, early 40s, and wondering if you are in perimenopause. In this um, live, I'm going to share with you the symptoms, the treatments, what can help make it better. And so I'm just going to kind of wait a little bit and give a few minutes for people to join. And let me see if I can see the comments. So I want you to interact, comment below what questions you have, and let me know. Are you in perimenopause, menopause, not sure, wondering? Let me know. Because I realized that people don't really talk about perimenopause, and it's really interesting. I don't ever remember too many people really speaking about it. I do remember when my mom was going through menopause, she was having hot flashes. They were very, very bad. I remember they were very uncomfortable for her. I do remember that. And I'm in my 40s now, and I have started to go through perimenopause. I think I probably started around my early 40s. So I realized that there was a lot that I didn't know about perimenopause. I also am an internal medicine doctor, and I was flabbergasted. And I was like, I do not recall, I'm transparent. I'm just going to keep it real. I was like, I don't recall learning about or learning much about menopause or perimenopause in medical school or residency. And, I asked my friends and they say the same thing. And even my friends who are OBGYN doctors also say the same thing, that they don't learn that much about it in their training, which is surprising to me. So, it's kind of like the longer I get out of residency, I realize that this field really, you have to be a lifelong learner, and I love it, and I have no problem with continuing to learn. And so I've been reading and studying about perimenopause and menopause as I am going through it. And so this video is to help you if you're a woman in your late 30s, early 40s, 40s, 50s. I'm going to go over what perimenopause is, what menopause is, the symptoms, and some recommendations for you so that that period can be smoother for you. Because I think that there are a lot of women who are like in their early 40s, mid 40s, who suddenly feel completely irritated with life, anxious, irritability, problem sleeping, insomnia, depression, new depression, even and anxiety, and they are wondering what's going on. It feels like a new person. And some of these women, I believe, are married. And when they get to this phase, they think that this irritability is all their husband's fault. And I think that there are some women who actually divorced their husband. This is just what I think. I don't know where I got this from, but I just feel like there are some women who, when they went through perimenopause, started going through the mood changes and got so irritated with everything and thought that their husband was a problem and divorced their husband. I've seen a lot of people getting divorced in their 40s. And knowing what I've gone through, and I'm in my 40s, I'm like, my tolerance for a lot of things was extremely low. Like when I first started going through perimenopause, like I'm sure that if I was in a relationship, I would be very snappy and irritable towards my spouse, my husband, or whatnot. So I'm just like, ladies, this could all be hormones if you're feeling any of these things. So first off, let me see who's watching. Comment below. Um, if you're in perimenopause, if you're in menopause, or you already know, or if you're wondering, what questions do you have about it? This live is going to be about that perimenopause, menopause. So, perimenopause is the period before menopause. And during perimenopause, so perimenopause can occur and start 10 years before menopause occurs. That's really important because people often talk about menopause when your periods stop, and that's all they talk about. In fact, when I went to my primary doctor and my OBGYN, who are both amazing, by the way, And I told them, I think I might be in perimenopause. What do you think? And they asked me the one question: Are you still having your periods? And I said yes. And that's all they asked me. And I later learned that that was not sufficient because there are many other symptoms of perimenopause. When someone is not having their period for 12 months or more, I think the time frame is, that's actually menopause. Right? Well, I'm talking about perimenopause, which I'm finding that a lot of doctors, including myself, did not know about. Okay. I am 44. I go 45 this month. And so I am the root it. So I'm telling you, this thing is real and it can seriously disrupt your life. And looking back, I think I started to go through it in my 40s. Now, it was the same time as pandemic. For the first time in my life, I felt depressed, anxious, irritable. I was just vexed with everything and everybody. It was also a pandemic. I was on the front line working in the hospital, so I thought it was just stress related to that. But now looking back, I think that also hormones, perimenopause played a role in that. And then it didn't help that I got a um, condition, I suppose, where the symptoms actually can overlap a little bit. When I got my first and second COVID infection, I had lasting symptoms for like the next year or two. And so it's led me down a journey of being a patient and studying things that I never studied before or knew about. So I know that this can help. So okay, so there's a question already in the thing. Oh, I hate the question. Do you still got your period? I know that's the only question they ask. So what I've learned, so what I've learned is that when you're in perimenopause, you will still have your period, but your cycle may be shorter. So with me, what I found is that normally my period comes on every 28 days, like clockwork. I actually track it in a app. And I've noticed that when I started going through perimenopause, like now, my cycle, instead of it being 28 days, it's 21 days. So my period is coming on sooner. So that's the first thing. Your cycle may be irregular as well. And your cycle may be shorter, it may be longer, and you may skip one cycle here and there. You may not skip every month, but you may skip one cycle here or there. And also, your period may be heavier or lighter. And that's what happened to me. My period became much heavier, and my cycle was shorter. Okay, so we're talking about perimenopause. Also, what you will notice is that you will experience night sweats. That was the first thing that I notice. And from training, we learn mostly night sweats as we call it like a constitutional symptom of like an infection, like TB or something else like that. And so it took me a minute to be like, okay, wait, this could be hormonal after I considered other things. So I noticed what helps me is that I turn the air condition down so that it's cooler at night. I dress in cotton clothes, light clothes, not too many sheets. But I do wake up every night and I'm sweating, and there's that. At first, it was every once a week, but now I'm noticing it's more often. The night sweats, and just this week, I had my first hot flash. Like I had two. And I was like, oh my gosh, this is terrible. How come nobody ever talks about this? So let me know. Are you guys experiencing hot flashes? Are you having night sweats? Like, what is it like for you? Because when I had this hot flash, I was in the store and all of a sudden I felt hot, sweaty, flushed. Like my face felt flushed. I almost felt a little bit dizzy, like I needed to sit down. And I sat down for like 10 minutes and I was like ravenous as far as like hungry. I was craving sugar all of a sudden. So part of me was like, okay, is my blood sugar low? But then later I was like, no, I think that this was actually a hot flash because I was like sweating. Like you see, my hair is straight and it ain't even lasting lately because I've been sweating. I've been realizing in my hair, my upper body. So let me know, what do hot flashes feel like for you guys? And also, what I've noticed about hot flashes, caffeine makes them worse. Oh my goodness. Last week, I was craving coffee. Okay. So I had like two or three drinks of coffee, and the hot flashes were like relentless. So that's a pro tip. Unfortunately, coffee, as it is nice sometimes. Some people like it. I like it sometimes. Not a lot, but sometimes it does make the hot flash is worse. And I see somebody says it in the comment, for the first time, caffeine irritates you. Yeah, exactly. It never used to really bother me. I never have been a big coffee drinker, but my tolerance to it now is lower. So I'm like, it's enough for me not to drink it again, like ever, like for real, for real. Um, and when somebody says used to be able to drink teas, coffee, and sodas, and you've had to really change your diet. Yeah, that's awesome that you've noticed that there's a difference, between the foods that you eat. That's really awesome. Another thing that you will notice is sugar. Sugar makes hot flashes and symptoms of perimenopause worse as well. And when I say sugar, I'm not talking about natural sugar that's fructose and fruit. I'm talking about added sugars in like chocolate, cakes, cookies, and cupcakes. And that one is hard because I feel like if it's that time of the month or if you're in perimenopause, you may be irritable like a lot. And so your body might crave sugar. And then it's like, but sugar makes the hot flashes worse. So it's like a catch 22. Like, what do you do? So, yeah, that's also what I've learned, what I know. So, what I do is I keep fruit in my house that is enjoyable to me, that can help fill that sugar crave that I might get. So, like watermelon, mango, are fruits that are sweeter than some of the others. I would also say grapes and cherries. So I keep those on hand when I'm craving sweets. I did buy some fruit ice popsicles the other day because I am hot a lot. And North Carolina heat right now is just brutal. It's like, I feel like it's an oven. So I'm finding myself sucking ice and eating these popsicles so that I can cool down during the day. And it's like, it's just so funny. So, hello everyone, welcome for joining. I just decided to do this live about perimenopause and menopause. So let me know, what questions do you have about it, and what symptoms you're having. If you have any questions, I'll be happy to help. So yeah, so I said I still have my period, but the cycle is shorter, so it's every 21 days. And my periods are heavier. So what has helped with that? Well, let me go through the symptoms again first, and then I'll go to treatments. Okay, so the common symptoms of perimenopause, I talked about the menstrual changes. Your cycle can be irregular. The cycle can be shorter. So instead of 28 days, it may come every 21 days. It may be longer, and then you may skip a period, 1 month or here. You may have heavier or lighter bleeding. I talked about hot flashes and night sweats. Usually, the night sweat starts first. You may have sleep disturbances, so insomnia and early waking. I get that every day. I'm waking up in the middle of the night. Mood swings, irritability, anxiety, or depression. And then also, you may have brain fog or difficulty concentrating, as well as decreased libido, vaginal dryness, or discomfort during intimacy or sex. You might also experience breast tenderness, fatigue, so just feeling unusually tired, whereas the normal activities you partake in now drain your energy. You might also notice weight gain, especially around your midsection. I noticed when I turned 40 that I've never struggled with weight, but when I turned 40, the same pretty healthy diet that I have, I'm active, wasn't really working as well, meaning I was starting to gain some abdominal fat. I had like a little belly and I didn't like it. I was like, what is this? Right. And so that's when I started intermittent fasting. So now I only eat 2 meals a day, and that works pretty good for me. I eat my first meal around 12, my second one around 5 or 6. So you may experience weight gain that's not even related to you changing your diet, eating crazy, and like not exercising. It could just be hormonal. So keep that in mind. Be kind and gracious to yourself. Perimenopause is no joke. You might also experience joint pain or stiffness, hair thinning or changes in your skin, heart palpitations, or urinary urgency or incontinence. So, like an urge to urinate and you have to go to the bathroom right away, or leaking or something like that. Yeah. So, let me know in the comments, what symptoms have you noticed? Have you noticed any of these symptoms? And are they manageable to you? Are there some treatments that you found beneficial? Let me know what you guys are doing. Um, So, I also want to share with you some recommendations. So, first, there is a certification that healthcare providers, physicians, physician assistants, nurse practitioners can take. It's called a menopause certification, and they learn about menopause and perimenopause. I think it's self study. I'm not sure exactly how long it takes. But here's the thing, like I told you, I went to my regular doctor. She's amazing. I went to my regular OBGYN, and they only asked me that one question. And it was clear to me after a while that they, like me, who's also a physician, didn't really know much about perimenopause. And so when I went online, I found out that there is a certification. And so I found a certified menopause specialist. She is an OBGYN and she has been a lifesaver for me. I've seen her 2 times so far. I saw her last year and then I actually saw her today. So that's why this is all fresh in my mind. I'm like, let me record a video. So when I had my hot flash yesterday, actually, I called and made an appointment. Lucky I got one today. She's been amazing. And your certified menopause specialist can help you to um, decide what treatments and what therapies you should get. Like, should you get HRT, hormone replacement therapy? Is birth control something that's beneficial for you? And so, let me share with you what I've learned and what I know about the two hormonal options. And then I'll talk about some natural ones. So, when my cycle started to get heavy and my pain and it was very painful, my doctor put me on OCP, oral contraceptive pills, oral birth control. That's a combined pill with estrogen and progesterone. And that has helped significantly. So my appointment today was to find out, because I'm having more symptoms of perimenopause. My question was, am I still in perimenopause? Am I in menopause? And should I start hormone replacement therapy? And so, what my doctor said is, she said that in order to tell if you're in menopause, what you'd have to do is test your FSH level, follicle stimulating hormone level. And in order to get an accurate reading of that, you have to not be on birth control. So for me, she was saying we would have to stop the medication and then check a level. But she didn't feel that it would be that useful. Why am I saying that? I'm saying that because whether you're in perimenopause or perimenopause, rather than checking a test to tell, you have to think about, will it change the management? Like, will it change what prescription you get or something like that? So it's not really necessary to check hormones. Perimenopause is a clinical diagnosis. I've never had my hormones checked, actually. I think there's a lot of misconceptions. People think that you need your hormone levels checked. But it's my understanding, and that's what my doctor said, that you don't. I know some people probably disagree and check them, but my doctor said that there was no need for me to check them. And in most cases, it's not very helpful because the hormone levels fluctuate up and down so much during the month. So it's kind of hard to tell, like, okay, if it's high when you check it today, like, what does that mean? So this is really important because perimenopause is a clinical diagnosis. That's really important. Now, I want to talk about the treatments. Um, and I see someone's asking a very good question about, should we start HRT or should we wait until menopause? That is an amazing question. And a lot of people, including doctors, think that you should wait until menopause to start HRT. It's actually been shown, and there's data on this, that it's more beneficial if you started before menopause. So like 10 years before menopause, or like whenever you're in perimenopause, you theoretically could start HRT, but this is a clinical decision that your doctor has to make. Um, that's my understanding. So it's not necessary to wait until your periods have completely stopped, is what I'm saying. When your periods have completely stopped for 12 months, that's technically menopause. So it's not necessary to wait until that. So that's why me now, I'm 44. I'm having conversations with my doctor. I'm probably going to see her, frequently as time goes on, to be like, okay, should I start HRT? No. Like I said, I saw her today and she said she didn't think that I needed it. What we did was she changed my birth control to a different one that kind of she said might be better and help some of the night sweats and hot flashes. So hopefully that's helpful. Who's not a candidate for HRT? Women with certain cancers, if you have a history of blood clots and you smoke, or if you have liver disease. But generally, my understanding is that most people actually do benefit, meaning the benefit outweighs the risk. Now, I know that maybe 10 years ago, and some of this thought is still circulating, it used to be like a large fear around HRT. People thought that if you prescribed it, you were going to get blood clots and cancers. And from what I've read, that's really not the case. And that study, there were some limitations with it, is what I understand. And so, like I said, I read a couple of articles and books about perimenopause, menopause, and I've spoken to my menopause specialist. And HRT can be very beneficial for a lot of women, particularly with the two symptoms, vaginal dryness and hot flashes. It can help a lot. And I know from me, and my doctor says is indicated to go on it, I'm gonna go on it. I'll switch from the birth control to the HRT. Um, I also want to explain that HRT is estrogen and progesterone, just like birth control, oral combined birth control is two hormones, estrogen and progesterone. The difference is that the dose in HRT is lower. And that's the difference. So just keep that in mind. Um, and now that, it's funny when you go through something that makes you think about it and you're more aware of it. And so I'm saying, people don't know about perimenopause. They don't know about HRT and how helpful it can be. And since I'm in the thick of it, it's at the forefront of my mind. Because like I say, every night I wake up, I can't even sleep through the night. And I've tried sleeping medication, everything. I've tried, like, I turn the AC down at night. I still wake up sweating. It used to be like once a week, when now it's like every night. So I'm like, this could help some people. Like getting on hormone replacement therapy can potentially help you. And seeing a certified menopause specialist, that really is the biggest takeaway point from this video. Do not suffer in silence. Do not think that your doctor knows everything. We do not know everything. Rest assured. And I learned that there was such thing as a certified menopause specialist. I didn't even know that before. I was like, what is that? I thought OBGYNs learned this in their training, but apparently they don't. My OBGYN friends are studying for it and they're like, nah, we didn't learn all this, right? So do yourself a favor. If you're in the US, go on Google. The Menopause Society actually has a search where you can search for a doctor. If you're in Raleigh, Durham, I'll tell you who I went to because she's very good and I highly recommend her. It is Capital Area OBGYN, Dr. Claire Sellers. Changed my life. She is amazing. I feel listened to. She's very knowledgeable, and I mean, it's just the experience is just amazing. When you see somebody that is an expert in that little area that you need help with, it's life changing. See, I'm feeling hot right now. All right. So the next thing, what questions do you guys have? Because I don't want to talk too fast or too much. We're talking about perimenopause and menopause for all my ladies who are in their late 30s and 40s. So we talked about the things that can make it worse: caffeine, added sugars, and I think I also read alcohol as well can make it worse. And I talked about some of the common drugs. So I want to touch on some other non-hormonal medications that you might want to consider. Um, I would say not secondary, but I'm an advocate for HRT. If your doctor recommends it, if it's appropriate, I am. But there are non-hormonal medications, I should say. So there are drugs that are like in the depressant class. We call them SSRIs or SNRIs. Examples are paroxetine or venlafaxine. And these can help with hot flashes and your mood. Now, there are some side effects of this medicines, but just discuss that with your doctor, right? Um, yeah. Second is gabapentin that can help with night sweats. It's like a nerve medication. It's also used for diabetic neuropathy. And then a third medication is clonidine. That's actually a blood pressure medication and sometimes used for hot flashes, but not that often. And then there's also vaginal estrogen for vaginal dryness and pain with sex. So there's that. And then some natural herbal remedies. And I'm just gonna kind of list them. You really kind of have to try them and see what works. Because what works for somebody might not work for everybody. So there's black cohosh, and that's a supplement. There is evening primrose oil, ashwagandha or rhodiola, maca root, and something called chaste berry or Vitax that supposedly helps with hormonal balance. But specifically, I know I've tried black cohosh and it's supposed to help with hot flashes. I'm not sure if it's really working. I bought a supplement by this brand called Thorne, Thorne, and they have a menopause, perimenopause supplement with black cohosh in it and like five other things. I'm not sure it's working. But maybe I need to take it longer. I'm not sure. But if you look online, like Amazon, or if you're in Bermuda, the pharmacy there might have some kind of natural supplement for menopause. Is or perimenopause. Worth trying it if you're having hot flashes, whatnot. Is there a taboo about it? About what? Soy or HRT or black cohosh? Lord, somebody commented, so I was curious. Let's see. Nutrition. I would say I talked about reducing the sugar because sugar and caffeine makes it worse. Of course, healthy diet is always going to be good, right? Your vegetables. I don't need to beat a dead horse. Eating your vegetables, getting enough calcium, vitamin D to maintain bone health. Um, Magnesium can help with sleep and mood and stress. I actually recommend, well, I can't say what I recommend because they can be like, this is medical advice. This is not medical advice. I take a magnesium supplement and I know that it helps me to sleep. And I have patients and people that say it helps them to sleep. Hydration can help with the dry skin if you're having that. Can help with your cognitive function as well. So making sure you're drinking enough water. At least 6, 7, 8 cups a day, something like that. And then phytoestrogens. Okay, so let's talk about soy. Thank you, Loida, for that. Soy can supposedly help with hot flashes. And soy is a phytoestrogen, which is like a plant estrogen. And I know that there is controversy around soy, and this will be until the end of time. There are two camps. There are people that believe that soy is terrible, nobody should ever eat it. And they believe that it causes man boobs, messes up your hormones, and is just like the worst thing ever. I am not in that camp. There are other people who believe that soy is beneficial, that soy can be helpful, and that soy is a part of a healthy diet. This is the interesting thing about nutrition and science. You will always find people on both sides of the argument, both educated, both informed, both smart people who disagree, and that is okay. I believe the data that I have read supports that soy is beneficial and actually can be protective against certain cancers, in fact. And I think that the people that believe and really heavily promote that soy should be avoided for everybody, I think that they cherry pick the articles that they read. And some of the studies that I've noticed are really not great studies. They're like small or there are like limitations in them. But do what makes you feel comfortable, really is the bottom line. So I eat soy. I recommend my patients and my clients to eat soy if they choose to, you know, a couple times a week, even once a day if you want to, is still fine. It's not going to harm you. Um, and there was one study actually that did look at soy, and I think some of the people that are against soy use this one, but the people were eating soy like 5, 6 times a day, like a lot. So like I say, soy is controversial. Some people say it's terrible, don't eat it, and then some people like me believe that it is a healthy plant source of protein. And so I eat soy. So again, I don't argue with people about that, but just do what makes you comfortable. But yeah, there is a lot of taboo around soy. People get arguments around soy. You go on YouTube, you'll find a lot of different opinions about soy. So it's just funny to me. But I eat soy, I eat tofu, and yeah. So, but it's funny because some of my guy friends, some of the men that I know, they will not eat soy. They are very concerned that soy will make them have man boobs and make them like feminine. They're like, I cannot eat soy. I'm like, okay, it's fine, don't eat it. Yeah. So let's see. What other comments or questions do you guys have? Okay, I'm gonna have 30 minutes, and I can actually go up into an hour if there's other questions. I really just wanted to jump on here and share the symptoms of perimenopause, menopause, as well as some medication and lifestyle tips, changes that you can do and discuss with your doctor that can help make it better for you. Oh, also, let me not forget this. Exercise actually helps a lot too. Exercise helps your mood, helps you to feel better, helps you to sleep better as well, especially if it's in the early part of the day. And secondly, prioritizing sleep is important too. Going to bed at the same time every night is good, at a decent time. What works for you? Like some people go to bed earlier, like 9 o'clock. Some people like 10 or 11. That's okay. But having a nighttime routine where you're going to bed at the same time and then having kind of like a wind down before bed is helpful. So yeah, so that's pretty much what I wanted to share with you guys. Comment below. Let me know where are you guys tuning in from? You guys in the States, Bermuda? If you're in the States, what state are you in? Put that in the comments so I can see where is the people watching from. Like right now, North Carolina has been hot. I just came back from Bermuda a month ago. As you probably know from other posts on my page, it was humid there. And I'm in Raleigh, Durham, and today I was just looking to see the temperature. It was up to 91 degrees. It feels like I am walking outside in a sauna. But yeah. So hopefully this was helpful. If you want me to do more videos about menopause and perimenopause, let me know. Again, ladies, if you're in your late 30s, early 40s, mid 40s, you're probably going through perimenopause and you might not know it. And if you are, there's no need to suffer with symptoms in silence. I believe that symptoms are like an alarm going off for you to tell you that something is out of balance in your body and there's no reason to suffer. Go to your doctor. Um, go online, look up stuff, and get you some relief. It could be a prescription, it could be a dietary change that you need to make, it could be a natural supplement. But life is hard enough as it is. Life is stressful right now, especially in 2025. It's too much craziness going on in this world politically, between the economy, cost of groceries is going up, politics, wars, Israel, Iran, plane crashes, people dying. I feel like a lot of people that I know have died recently. It's a lot going on. You don't need symptoms on top of that. Believe you me, I know because I've been through it. Fatigue alone on top of the stress of life is enough to really just knock you down. And then on top of that, let's say if you got irritability or you're not sleeping well, you got kids, you're having night sweats, it's a lot. But there is relief. That's what I want you to know. And hormone replacement therapy could potentially be an option and it could help you. So, yeah. So that's all I want to share. Oh, I bought a fan and I didn't even buy it for this reason. I bought it a couple of months ago. I'm actually about to pull it out. I bought like this little portable fan. It's kind of like this. It kind of goes on a stand. Yes, I'm about to carry that around in public. And I used to smile at people that would pull that out, but I'm about to pull that out and just fan myself. If I'm out somewhere and I got hot, or if I have a hot flash, so it ain't gonna be no shame in my game. You hear me? Okay. And yeah. But I was seriously munching on some ice yesterday. Girl, goodness. Um, Yeah, it's just interesting. So yeah, hopefully this was helpful, guys. I'm about to sign off if there's no more questions, comments. It's not too long, so you can easily go back to it, watch it, review it, and whatnot. But yeah, whew, the stuff that women go through, our bodies go through so much. And then y'all that have had kids, I've never had kids, but your body goes through so many changes when you have kids as well. We are like so resilient. You have to be so resilient just to be a woman. You know what I mean? Seriously. We carry so much. And then we work. Women these days work and take care of kids, the household, do all the stuff around the house while balancing what feels like your body falling apart. It can feel like that sometimes, but there is hope. So that's all. But I hope you guys are having a good day. Um, like I say, I know it's a lot of craziness going on in the world. You may be stressed. I don't know, but um, I want to say things will get better. That's what I want to say. But I want to say that there is hope though, for sure. You're in perimenopause, menopause, and if you have any other questions, let me know. Other than that, have a good night, and I will see you in the next live video. And also, go to my YouTube channel. I don't usually stream to both Facebook and YouTube. Usually, I just do YouTube, but I said let me do it on Facebook today. But if you're on Facebook, please go to my YouTube channel, Dr. Judy MD. Subscribe there so that the next time that I go live, you will not miss a video and that you will catch it. Okay. And then also, Facebook is about to delete all live videos. So I think this is going to get deleted from Facebook in like 30 days. Facebook is always changing. But anyway, have a good night. Love you guys. God loves you too as well. Be blessed. Bye.